Good afternoon. Thank you for joining me today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 328 new cases of COVID-19. This brings our statewide total to 95,742 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 6,911 deaths have been attributed to COVID-19 in Pennsylvania. Our recovery rate from COVID-19 is now at 77%, which means that 77% of individuals who have had COVID-19 have recovered. In the last 7 days, there have been 135,631 tests performed for COVID-19, with 5,560 positive results. The average number of tests being performed in the last 30 days is 15,881 tests. And we've had a maximum of more than 22,000 tests per day that was done last week. From March 3rd, 2020 to July 13th, 2020, 1,148,174 PCR tests, that's the usual diagnostic tests for COVID-19, have been done in Pennsylvania, which is approximately 9% of the population of Pennsylvania. Since the start of the outbreak, there have been 804,764 patients who have tested negative for COVID-19. Now, comparing the last 7 days to the previous 7 days, we have seen case counts increase in 43 counties in Pennsylvania for a 14.4% increase statewide. We have been seeing increases in the number of new cases of COVID-19 in Pennsylvania. The percent positivity rate, the percent of the tests that are positive, has increased in 28 counties in Pennsylvania. But statewide has actually gone down somewhat to 4.4%. There are currently 652 patients with COVID-19 hospitalized in Pennsylvania, and 91 of those patients have required the use of a ventilator or breathing machine. And that percentage has consistently gone down because of a change in medical practice. Since the start of the pandemic, there have been now 18,279 cases among residents in long-term care living facilities and 3,481 cases among employees, now at 750 distinct facilities. Now, these are nursing homes and personal care homes and assisted living homes. The recent increases that we have seen in the number of patient cases and staff cases, as well as the number of facilities, is actually because of our universal testing policy, where we're testing all of the staff and all of the patients in all of these facilities. And we are picking up asymptomatic individuals among staff and the residents, which is the point of the universal testing, so we can do appropriate isolation, quarantine, and cohorting. Nearly 300 skilled nursing homes have completed universal testing, and more than 60 have scheduled testing, and they have until July 24th to complete this universal testing. At the start of the pandemic, we saw a higher number of cases right at the beginning in people ages 19 to 49 before it spread to seniors age 65 and older. This pattern is now repeating. The number of people over 65 who are positive for COVID-19 has gone down to about half our cases, while the number of cases in the 19 to 49 age bracket now accounts for 45% of our cases. Our experience from the beginning of the pandemic shows that the first cases rise in those younger individuals, some of whom did become quite sick, requiring hospitalization, and then went on to recover. Then Then COVID-19 spread quickly through the community, impacting congregate settings like nursing homes, where most of the most serious illnesses and deaths have occurred. This is the pattern that has been seen in other states as well. So there are things we can do right now to stop this cycle. First, please wear a mask when you're going out in public. If you are in a situation, whether you are considering whether or not you need a mask and you're thinking about it, then the answer is yes, wear a mask. Avoid situations where you could be exposing yourself to COVID-19. For example, if you feel uncomfortable with how close people are at, for instance, a restaurant where you might be dining, then make the choice to leave. If you are in a store where people are not following the mandatory mask order, then make a choice to leave that store. If you're getting together with people who might be talking that they are not changing their lifestyle, that they're not wearing masks, then make a choice not to go and to be with those people. As much as our efforts are about laws and mandates and requirements, they're actually mostly about your choices. In Pennsylvania, we're all in the green phase. We've been able to return to work. But our actions as a community will continue to impact whether we can stay at work. Now, clearly, we are seeing cases across the United States skyrocket. Other states that did not have the surge that we experienced in the spring are now experiencing an even more dramatic surge and strain on their healthcare system that actually we were able to avoid. Pennsylvania, and I'd like to highlight this, is not seeing the cases into the thousands per day that are being seen in other states such as Florida, such as Texas, such as Arizona, such as California, South Carolina, and others. Local officials like those in Allegheny County have taken precise and targeted mitigation actions to stop the virus from getting out of control, and those are working. We are very carefully monitoring data from across the state to ensure that we stay on the right track. What's most important for Pennsylvanians to know right now is that in order to go about their routines, we need to make important choices to lower our risk. We have to adapt our activities to protect against COVID-19 and make the choice to not do some of those activities if they're not safe. That means, please, go for a walk, go hiking, enjoy state parks, but take your mask just like you take your sunscreen. Think about yourself, think about your family, think about your community and others, and make those smart choices, those smart daily habits. So here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or as we all should know now, the time it takes to sing happy birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch surfaces, and then especially touch your face, and clean surfaces frequently. And if you're going out and you're going to be in public in any way, whether it's indoors or outdoors, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Program Get Help Now hotline at 1-800-662-HELP. 1-800-662-HELP. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember: stay calm, stay alert, and stay safe. And now I'm very pleased to answer questions. Yes?
With 43 counties seeing increased case rates, is the Wolf administration currently discussing any ideas of moving any counties back to the red or yellow phases, or are you planning to leave that up to county governments?
Well, we are looking at all of our case counts very carefully throughout the state. We do not plan at this time to use those dramatic statewide type of measures, the colors, the red, yellow, and green schema, but we're going to watch them very carefully. We strongly support the targeted mitigation effort that was implemented by Dr. Bogan in Allegheny County, and we'll be considering the data every day. Yes?
Could you talk to me about the percent positive and how that's an important thing? Because clearly as we increase the number of cases of testing, the number of positives likely go up, but that doesn't mean it's a worse situation necessarily, or does it? What's the number you're looking at? As you said, it's about 4.4% percent positivity. At what level that it goes to a number that alarms you or concerns you? Just talk to me about your methodology and what you're thinking about there.
Absolutely. So you're right. Those are different types of measures. There's the incidence rate, which is the number per 100,000, the number per capita, and we watch that very closely. But you are correct. As we do more testing, we're picking up more asymptomatic individuals, possibly in the community or particularly in long-term care living facilities. And so we look at that percent positivity. What percent of the tests we're doing are positive? If this is due to our increased testing, especially of asymptomatic people, actually that will go down. If it's due to an increased prevalence of COVID-19, that percent positivity will go up. There's no one hard and fast line, but 5% is something that we watch really carefully. And so if the percent positivity is under 5%, that's a really good sign. If it's starting to creep above 5%, especially get headed towards 10%, that's a bad sign.
As you see Florida and other states, they're way in double digits. Are you concerned when you see things in other states that ultimately could be coming here? People travel there, or to here from there, where people travel there and come back?
So we are concerned about that. So we're concerned, of course, about the rapid increases that we have seen in those other states. We're concerned about traveling, and we're concerned that one state will lead to a next contiguous state and head north and head east. So those are all things that we watch really, really carefully. Yes?
Speaking of testing, the original federal goals for states was about 2% of people per month tested. We've been doing more than that, but as we have more capability, is there a higher goal of people, a percentage of people tested per month that you're going to set?
Yeah, so we have gone far beyond our 2% of individuals in our state per month, and we're now looking at higher numbers, so 4% and then maybe higher as well. So we're very pleased with the amount of increased testing that we have. We want to, but we're not satisfied. We want to continue to increase testing. We have very good partnerships with community stores and national chains, so such as CVS and Rite Aid and Walmart. We have some other chains that we're looking at. We've been working with our FQHCs, or federally qualified health centers, to do testing, and we want to increase testing and make it available and accessible throughout Pennsylvania.
Is there like a goal percentage?
Well, I think we've gone from 2%, and we're going to look to 4%, and they'll be looking beyond that. So there's no final goal, but yes, we keep challenging ourselves in terms of increasing that. Yes?
On the travel self-quarantine orders
Yes.
that you've put out for those states, are those mandatory or recommended for self-quarantine?
Those are recommendations. They're not mandatory. They're very hard, of course, to enforce because we don't keep track of people's traveling. And so those are recommendations that if you have come from Florida, if you have come from Texas and Arizona and South Carolina, that those states have extremely high prevalence rates, as we've been discussing, and incidence rates, but they also have very high percent positivity rates, and we feel it is prudent to and recommended that they quarantine for 2 weeks.
So what would you give guidance to public sector and then private sector employers if someone is in that situation?
Well, so we don't determine their policy, but we feel that they should develop HR policies in terms of those individuals. So maybe in a perfect world, they could work from home. So if they're required to quarantine, that they could telework. There are some fields where you can't do that, and then they have to work on what their leave policies will be. But that is one of the ways that COVID-19 can increase in Pennsylvania, as if a lot of people have come from those hot zones, such as Florida. And if they are asymptomatic, for example, or pre-symptomatic, and they bring it to Pennsylvania, then that increases our numbers. Yes?
I know you said it's kind of hard to enforce, but will Pennsylvania try to implement any enforcement efforts on that? I know New York said they just put in an idea that they're going to try to enforce it.
We have no plans to enforce that at this time, which is why it's not an order, why it's not a mandate, it's a recommendation. Yes?
How are we doing with contact tracing, and to what extent are we actually tracking down people and isolating people?
Yes. So we're doing really well with our contact tracing, and that is the heart of our containment strategy. So our containment strategy means we increase testing. Again, we're well over 15,000 average per day over the last 30 days. We were very pleased with over 22,000 one day last week, and we're going to continue to work on that. Those individuals that are diagnosed as positive, they are all contacted by health department. They have to isolate. Then we do case investigations, find out who their contacts are. We have well over 600 contact tracers now, and we want to have more, but we've met that goal at the end of June, beginning of July, for well over 600. We'll contact those individuals, and then they will quarantine for 2 weeks. This, of course, is a collaboration with the Department of Health, with our county and municipal health department partners that have lead in those counties. For instance, Dr. Bogan in Allegheny County, they have lead, although because of the increases that have been seen in Allegheny County, we have offered support, and a number of our contact tracers are working with her department to help Allegheny County. We work really closely with Dr. Farley in Philadelphia, but really all of the county municipal health departments.
To what extent, though, are slow test results preventing the tracing from taking place the way you would like to see it, as quickly as you would like to see it?
So that is a real challenge, and one of the things that we're concerned about is the delay in terms of getting results. Now, for priority settings such as particular nursing homes or other priority settings, we do tests at our laboratory in Exton, and we can get those results out in 24 hours, at the most 48 hours. Most hospital laboratories can get results out in 24 to 48 hours. But what we're seeing are delays in the national companies. So those include LabCorp and Quest, but there are other national companies. They are being inundated with samples from the states that we just talked about. So whether it's Florida, Texas, California, Arizona, many other states. And so the amount of tests being done in the country is a real challenge to these national companies. Some of our delays are 7 days or more. That's a real challenge in terms of being able to tell people that they're positive and do isolation and then do the contact tracing. We do have calls scheduled with LabCorp and Quest to talk about the challenges that we have, but this is a national issue in terms of their capabilities. Yes?
Can you tell us why the Department of Health does not give recovery statistics and county-by-county number breakdowns?
So, we are generating an enormous amount of data every day. It's actually quite unprecedented. I mean, when we put out flu data, usually in the fall, fall, winter, and spring, we would put it out once a week. When we put out other data, sometimes it's once a month or yearly. So the amount of data that we are putting out is just unbelievable. And so we're doing a really good job with our data, but it does require a significant amount of staff time, and we have to prioritize. It's just not a priority, put out that county by county at this time. Yes?
A question from Pittsburgh TV station WTAE. It says multiple county leaders in Westmoreland, Beaver, and Washington counties stated that you had conference calls with you and your staff last Tuesday, during which they were told that DOH was planning to impose new restrictions for their counties, restrictions that were never actually implemented. So what happened between Tuesday and Thursday that caused you to change your mind about imposing restrictions on bars and restaurants in Beaver, Washington, and Westmoreland County.
So, we have been seeing increases in the Southwest, particularly in Allegheny County, but other counties have seen increases as well, particularly the 4 counties that you mentioned, but not only those counties. And so we did have a phone call with the county commissioners to update them on their case counts, to discuss targeted mitigation measures that we were considering. But in the end, looking at the data and discussing things with the governor's office and putting that all together, we decided to hold, and so far, at this time, we've decided not to implement those.
Did they kind of push back and say, hey, we really don't want you guys doing that, we think we can handle it otherwise?
We had a robust discussion, but that really, none of that influenced our decision. Really, it's the day-to-day numbers that influenced our decision, and we decided to hold for the present time. Yes?
For the high school athletes and student athletes that are now into summer workouts, there's been a little confusion on the mask wearing as they compete or as they practice. Could you clarify that?
Sure. So I think the PIAA has clarified it, but basically it depends if they can stay, we're talking about outdoor, if they can stay 6 feet apart or not. So if they are, for instance, on a baseball diamond, they are more than 6 feet apart, and so it isn't essential to wear a mask. If they're going to be close together, they need to wear a mask. And so it kind of depends on the ability to do social distancing.
So for a football lineman, as they line up,
it's going to be a real challenge. And so, I think that it'll depend upon what the teams are going to be able to do. But I have concerns about where social distancing will not be possible, such as a football lineman, that some mask wearing should be considered, but they're going to have to deal with that on a case-by-case basis.
and is there concern of heat exhaustion, heat stroke by wearing?
There is, and so we're going to have to take that in consideration as well. So, overall, it is safe to wear a mask, but if you're in very hot weather, then you're going to make sure you keep hydrated, and wearing a mask could be difficult. And I think that that's something that the coaches will have to take in consideration as they plan their practices. Is we have to do everything we can to protect the health of those young people, both preventing the spread of COVID-19 versus other health risks as well. Yes.
328 cases today reported. It's kind of a lower number compared
Yes.
to the past couple of weeks. Philadelphia County reporting no new cases today. Is this because of a lag time in reporting?
Several different things. One is that I can't speak to Philadelphia's data, but for our data, it's always lower, because of the weekend. But also, we get these delays in terms of the results that we get from LabCorp and Quest, as we were discussing. And so we will expect a data dump at some point this week from LabCorp and Quest, and then the numbers get jerky. And that's a real challenge for us, is that we'd like to have, the numbers be steady, but we are dependent upon these national laboratories. And, it isn't that they're not working hard. They are working double overtime to try to do all the tests that are necessary, but it's a real challenge. And so it makes sometimes our reporting somewhat jerky because of that, but we can't change that. Yes?
When I look at the hospital capacity numbers on the dashboard, the available capacity seems like it's been pretty consistent for a while. But now, I'm thinking there's more people in the hospital for non-COVID reasons.
That's correct.
How does, to what extent are the hospitals filling up for non-COVID reasons? And since the hospitals now can take more people because you're allowing elective surgeries and everything, when does it get to the point that you would start to worry about capacity?
So that's a very important point, and something that we discussed extensively in the spring, is that if there is a very large surge of cases, that could test hospitals' capacities. And we did limit elective operations, et cetera, in the spring. We are not anywhere near that now. Other states, though, are having significant issues, particularly Florida, and then some areas of Texas and Arizona in terms of hospital capacity. We are not there, and we don't want to get there. So we do not want to get to the point where we have to cancel elective surgeries, and because we're concerned about the capacity of our healthcare system, which is why it's so important to practice everything that I just talked about, in that we can prevent that by having the public wear masks, by having them social distance, by having them make the right choices, that if they go into a restaurant and it's packed, don't go to that restaurant. There's no way you can social distance if they're not following the rules. If you go into a store and there's lots of people without masks, that's a violation of our order. But you have to make your own choice of whether you're going to put yourself and your family and your community at risk. And if we all make the right choices, then we won't have to worry about our hospital capacity.
And just to make perfectly clear then, when I look at those numbers, trying to evaluate available capacity, those numbers, they reflect everybody who's in the hospital. Like, there's no kind of carve-out or separation for COVID patients, right?
No, we do. Well, I mean, we announced to you, though, we announced today the number of patients that were in the hospital and the number of patients on ventilators. And so we announced that really every day, actually. So you're right. The vast majority of people in the hospital, the vast majority of people in the intensive care unit do not have COVID-19. And the hospital systems in Pennsylvania are not challenged. We want to keep it that way. Yes?
Speaking of choices, if people are curious and want to just go get tested, asymptomatic, not feeling anything, but is that something you guys want to do, test everybody at some point? Should we go get tested? Is that something you recommend?
So if someone wants to get tested, I have no objection to that, but we are not at the capacity that we can do widespread population-based testing. To do that and to do it really successfully, what we really need is a very rapid, accurate point-of-care test that can be done really simply with just a nasal swab or an oral swab, not the nasal pharyngeal swab, which is not as much fun as it sounds, and it can be done at 15 or 20 minutes with really, really good sensitivity. That test really doesn't exist yet, but when it exists, we are talking to companies in Pennsylvania that might be making those type of tests, but otherwise nationally, then we would like to do widespread population-based testing, and I think that would be really valuable. We're not there yet, but we want to test more and more people. Now, there are a lot of asymptomatic people being tested, and those who are having elective procedures. Most hospitals and health systems, if they're going to do an elective procedure, an elective can mean different things. They test that person. And so we're getting lots of asymptomatic screening, which is really useful for us. But to do it in a very widespread population base, we need that type of test. We don't have that yet. Yes?
On the return to school, any number of parents have reached out to us expressing significant concern about especially younger children going to school and having to wear a mask and having potential anxiety issues after that. What's your guidance along with Department of Ed on the return to school and wearing a mask and that type of deal as they go back in the fall?
Sure. So the Pennsylvania Department of Health is working really closely with the Pennsylvania Department of Education. They're working with their individual school districts, and we should have that specific guidance out for K through 12 shortly.